everybody, Brian Saladay here. I'm a licensed physical therapy assistant and a personal trainer. Today I wanted to discuss with you a few key and simple, easy things that you can do every morning that will decrease the risk of back injuries when you get up out of bed. So let's get started. So the first thing you want to consider when you're getting up out of bed is you want to keep your legs together. Keep your legs together. And you're going to want to roll over with your lower body and your upper body together. So you're going to keep your legs together. You're going to roll over on your side. As you roll over, you want to try to get this elbow underneath your shoulder, because when you're nice and stable, if it's way out in front, you can't push up. If it's way underneath, you can't push up. But if it's directly underneath, you have good symmetry and you can push right up. You keep your knees together. You're going to let your feet start to hang off the bed, kind of like a little lever. As one goes down, the other one has to come up. So my legs are hanging off. They're going to force my body to come up. I'm going to put one hand here. I'm going to push up with my right hand. Then I'm going to straighten my left hand. My legs are just going to hang off the bed, and I'm going to sit right up. And when I do that, what happens is I prevent any twisting when I come out of bed. And when we sleep all night, the fluid in our discs, it increases, because when we stand all day, the fluid decreases a little bit because we're of the vertical position of our spine. The fluid decreases a little bit in our vertebrae. However, when we lay down all night, the gravity's pushing down, we're laying horizontal, the discs fill back up. When the discs are big and bulgy, kind of like a water balloon in your spine, as you bend over, they can kind of push out the back side. So we want to avoid a lot of twisting and bending in the mornings. So that's the first thing. The second thing is when you to put your shoes on in the morning, you either if you're sitting on the bed, keep your chest tall, look straight ahead, pick them up, and then put them on. Okay? Or what you can do is, if you're standing up already, to pick them up, drop your hips, keep your chest tall, and pick them up, keeping your chest tall. I know it looks a little weird, but I'd rather you look a little weird than injured. And lastly, sometimes bulge or herniated disc can be caused from brushing your teeth in the morning. What happens is those big fluid discs are susceptible to bulging out the back of your spine. You brush your teeth in the morning, then you bend over to spit, and you stand back up, and since you bent over and went to stand back up, the disc went whoop right out the back. So what you should do is either keep your chest tall, kind of bend your knees when you go to spit in the sink, or just when you come back up, come back slowly. Don't just spit and just come right back up quickly. I hope this information helps, guys. For tons of more information, check out Standard Health LLC /Facebook, or check out standardhealthllc.com. I hope this information helps. Have a great day. I'll talk to you soon.